Hi, my name's Randy. I'm Chief Technology Officer for VDI Laboratory. And in this session, we're going to talk about the PTH 1 to 84 calcemia panel and also vitamin D toxicity panel. But I'm biased here, perhaps, but I'm going to tell you that I think we have the best calcemia panel that exists, bar none. I hope I'm going to be able to convince you as I go through here and present my arguments. All right, so let's go. So first of all, what is the calcemia panel? What does it do? What does it report? So it's designed to help you with endocrine disorders, such as primary hyperparathyroidism, secondary hyperparathyroidism, the classic hypercalcemia malignancy, which may not actually be due to malignancy, by the way. Sometimes people don't realize that. Hypoparathyroidism, which is kind of rare, but it's there nonetheless. And so what we're doing is we're looking at several markers to bring together and actually tell you what's going on. But before we do that, I always think it's a good idea to kind of step back for a moment and take a look at pathways, because endocrine disorders are all about abnormalities in the pathways. All right, so let's talk about it. First of all is vitamin D. So it's like, okay, we're talking about calcemia report. Why is vitamin D involved in this? And I'll explain why. So vitamin D, which exists in a variety of different forms. When we say vitamin D, what pops into your head? Is it like the little pill that you take that's got, in the morning you take, it's got 1,000 IUs of D3? That's right here, Is it 25 hydroxy vitamin D, which is what we test? So you send VDI a test for vitamin D. We are testing 25 hydroxy vitamin D. We're not testing D3. Or is it 125 dihydroxy vitamin D? Better known to you perhaps as calcitriol. Yes, calcitriol. So something like starting from the food or from the sunshine, for us anyway, not for the pets, becomes probably one of the most powerful hormones in the body and regulates, well, we're going to talk about calcium metabolism here, but it also regulates the innate immune process. Very, very powerful. And it's just 2 hydroxylation steps away from becoming a hormone. So bear that in mind. Now, it is a fat-soluble vitamin, so it does reach equilibrium with the adipose tissue, and it begins with D3, begins with also, after it hydroxylates with the liver to 25 hydroxy vitamin D, it also reaches equilibrium, and as well as calcitriol. So all these things are going in and out of the adipose tissue. So that equilibrium process takes about 2 months for a normal dog or a cat, and if the animal is obese, like twice of that. So just keep that in mind. And we do put on our reports retest windows, for example, that try to take that time window into effect, so you don't retest too soon. Otherwise, you're not getting that equilibrium effect. Now, what is the half-life of vitamin D? Because it doesn't just stay there forever. It's not like one and done. It constantly has to be coming into the body because it's constantly going back out of the body. It gets hydroxylated in the 24 position for both calcitriol as well as 25 hydroxy vitamin D, and it goes down the drain. It's out of the body. It's not biologically active anymore. It's gone. All right. So if it's not constantly coming in, hence dietary deficiencies, then you've got a problem. And it can also affect all of the calcium regulatory capabilities in there, because calcitriol, what does it do? It regulates calcium. Now I'm going to add one more thing into here because it often comes up, and that is magnesium. Because why? Well, magnesium is a cofactor for these enzymatic hydroxylation steps. So in the liver, there's an enzyme that hydroxylates it to the 25 position. There's another enzyme that hydroxylated in the first position. And so these enzymes need magnesium. Also, magnesium is needed for the production as well as the receptor function for PTH. So if you don't have enough magnesium, and something I always advise clients about is the patient magnesium level sufficient? Because while it's not utilized per se into the reaction, it is necessary for the reaction, and not just for calcium metabolism. It's regulating a lot of different enzymatic reactions within the body. So I always recommend you got to make track of magnesium levels. So what's so special about our calcemia report? Well, first of all, we'll start with PTH. PTH is what we call 1 to 84. It measures the whole PTH. Now, intact PTH, which is probably what you're familiar with, doesn't really measure the whole PTH. It measures a portion of the PTH. It's immunologically measured in the laboratory. And so what it does is it's able to measure biological fragments. So all hormones, I don't care what they are, they get enzymatically chewed up and spit out and disposed of because they can't stay there for very long. And so what happens is PTH gets chewed up and they can get accumulated in kidney disease. Particular problem in cats, but also dogs, so that if you've got any kind of patients with kidney disease, keep in mind that intact PTH might be accumulating with these biologically inactive fragments that can be interfering with the assay, which does not happen with our PTH 1 to 84 because it doesn't cross-react. That's a big difference with our PTH assay. We're the only company that has it. And so that gets us to classic renal disease in cats. Now, our Calcemia panel measures PTH 1 to 84, measures calcium, but it also measures vitamin D, which nobody does. And you might say, well, why? Why are you measuring vitamin D? Wouldn't I just get through telling you that it's important for that whole cascade? And in fact, if you measure the reference interval by the level of vitamin D, PTH changes. And actually, it narrows. It gets narrower as it moves along. And that's this graph, which we put on our report. And it actually goes down like this. You can see it actually narrows down. All right. So it always depends on where that vitamin D level is. So right here, we got 25-hydroxyvitamin D. We got PTH on the y-axis, and together that makes for we graph it. Here's the little triangle that tells you where this particular patient is. Now, this is the classic case. I see them many times with renal disease in cats. And what are we always fearful of in these renal disease patients is secondary hyperparathyroidism. What is that? That's basically, you can have normal calcium actually in these situations, or low normal, but you got high levels of PTH. All right. So, it's not uncommon to give calcitriol to these patients, which I highly advise against, because most of these patients are vitamin D, 25-hydroxyvitamin D, insufficient or deficient, like this one right here. And all that's necessary is to basically give vitamin D supplementation, drive up the 25D levels, and you'll drive up calcitriol levels, and it will move down to normal or near normal. And you shouldn't be giving calcitriol until you've actually gone through those steps, in my opinion on this, because it's just not necessary. It's very common on the human side to give calcitriol to end-stage renal disease patients. Well, why? They're end-stage. But animals aren't end-stage. They're not on dialysis. They still have kidney function, and they're still able to hydroxylate in that first position for 125-dihydroxyvitamin D. So let them do it. So give them D3, which will make 25D, and it'll go on. And so here, for example, is our report. And so what we do is, here's the calcium level. This one happens to be kind of normal, sort of maybe a little bit on the lower normal side. You can see pH is quite high, and vitamin D is in the deficient. This is really, really common. So here it is right here, deficient. Here it is right here in the secondary hyperparathyroid box, and we make the box for you. We actually plot it out for you. And then we add, like we do on all of our vitamin D reports. So if you test with vitamin D with us, this is what we give you as well. It's deficient, and then we tell you how to fix it. We tell you how to fix it for this patient, not some random average. This is for this particular patient. In this particular case, it's 500 IUs per day, and we'll tell you exactly what that's necessary. And notice right here, whenever we see this, we flag it. Remember I told you about magnesium? Recommend evaluating serum magnesium levels, all right? Because it's deficient. And often when we see deficient levels of 25-hydroxyvitamin D, it's not uncommon to see low levels of magnesium. Google it, you'll see it it's a human problem as well. If you've got NHAIDS, they did a big study and they looked at the association with magnesium with 25-hydroxyvitamin D deficiency, and sure enough, there's an association. It's true in dogs and cats. It's true in humans. Something for you to certainly consider. And now this would be the flip side of the coin. This would be hypercalcemia malignancy. Now we're down to this direction over here where we've got very low PTH, hypercalcemia. Vitamin D, of course, is way over here, and you can see it's outside the reference interval. All right, sufficient vitamin D, but it's outside the reference interval because it's really low. Why? Because we've gotten a tumor or maybe something else that's generating calcium that's outside of the endocrine system, and that's a problem. And the last one over here, I don't have a plot for it, but that's primary hyperparathyroidism. That is where you've got, over-secretion of PTH and hypercalcemia as a result, and certainly the report would demonstrate that as well. So in our report, you will see, this one happens to be primary hyperparathyroidism. You can see high calcium, high PTH, and then this one happened to have insufficient vitamin D in this example, but didn't matter. Point is that now this one is in the primary hyperparathyroidism category, and certainly something then you'd have to do imaging and move down that cascade of determining what the reason is for that. Now let's move on the story, which is now the next thing in terms of calcium regulation. And so I want to get into the subject of vitamin D toxicity, because, you hear about it all the time. Hill's had a recall and somebody, whatever, because, oh my God, there's too much vitamin D. And now we're going to kill all these animals because we've got toxicity. So let's kind of walk through that and understand it. And so calcium regulation is controlled by what? Well, it's controlled by calcitriol. It's not controlled by 25-hydroxyvitamin D. It's not controlled by D3. They are, in essence, inert, at least for serum calcium levels. They are important for the innate immune response, different subject. But as far as calcitriol goes, they are not the responsible party. Calcitriol is. Now, the big concern, of course, is that if you've got increasing levels of vitamin D3, increasing levels of 25-hydroxyvitamin D, then you might get increasing levels of calcitriol and hence hypercalcemia. Now, that is the problem, as you can see here. But when that occurs, there's other mechanisms that are coming into play. All right. So what does the reverse? Because remember, these are enzymatic functions. So there's enzymes in the liver, there's enzymes in the kidney, and these enzymes, these CYP enzymes, are whenever there's a high level of calcium in the body, then what's going to end up happening is these things are going to begin getting down-regulated, including PTH. Everything's going to get down-regulated. So if you've got a really high level of acute toxicity, like rat poisoning or something like that, sure, it can happen. Or you've got high levels dietarily, yes, it can happen as well. But generally speaking, the body works pretty well. I've had many cases where, the dog gets a hold of the vitamin D caplets and is now in, fear of being toxicity. And I've seen levels of 25-hydroxyvitamin D, normals up to about 100. They can get up to like 500. And because the half-life, remember the half-life is 2 to 3 weeks. It's pretty short. And nothing happens. Their calcium is just fine. It should be monitored. Yes, it should. But generally speaking, there's not too many problems in those cases. It's really more of the chronic dietary issues or the acute poisoning issues that are the most concerning. But we do have a toxicity report. So if it's something that you're of concern with, we have a report, and it includes, again, the same three: calcium, PTH, vitamin D. And what we're looking for is, even if vitamin D is elevated, if PTH is normal, calcium is normal, then toxicity is not a problem at the point of testing in this patient. And so not to be of concern. And again, it's not uncommon to see these values up to be 400, 500, and not to get too excited about it. So I think we have one of the best calcemia panels, bar none, because we can really help you with these renal patients, fragments, and understand the relationship of vitamin D to PTH that should be understood, as well as a toxicity panel, and hope that it becomes valuable to your clinic. Thank you for listening.